Mr. Schwartz, I'm going to go ahead and get you up to the chair again.
Maintaining the integrity of an intravenous infusion is an important part of your patient's total care. Regular systematic assessments of your patient, the IV site, and the infusion are necessary to ensure safe and appropriate care. Think critically and anticipate how the patient should respond and what type of complications might develop. For example, you are now providing post-operative care for Mr. Schwartz. Consider the following questions in your planning. What is your patient's current health status? What is your patient's anticipated response to IV therapy? What are the signs and symptoms of potential complications of IV therapy? And is the patient comfortable?
You can lean back. Let me just listen to your heart for a minute.
Planned assessments should take place every 1 to 2 hours. Include in your observations Mr. Schwartz's vital signs, fluid status, and intake and output.
All right.
Then perform a systematic assessment of the IV infusion.
Looks like your IV fluids may be slowing down just a bit.
Mr. Schwartz's IV is approximately 100 milliliters behind the volume that is due to be instilled at this time. A number of factors can explain the problem. First, check the drip rate. Use your watch to validate the infusion rate even if an infusion pump is being used. Here the nurse discovers that the IV is dripping at a rate slower than ordered. Look for any kinks in the tubing. Kinks can easily develop if the patient lies on the tubing or if it becomes caught between a side rail. Be sure the entire length of the tubing is patent and intact.
Take a little closer look at the site itself.
Assess the infusion site. The tubing and catheter hub connection should be intact with no signs of leakage or bleeding. Bleeding may occur when the IV catheter and tubing become disconnected, the patient has a bleeding disorder, or the patient is receiving heparin. Next, inspect the dressing and IV site more closely. The dressing should be dry and intact. Palpate the skin around the infusion site. The skin temperature should be normal with no swelling, and the patient should not be experiencing any pain. Use your critical thinking skills to evaluate your assessment findings and to take appropriate action when you suspect the development of a problem.
Doesn't seem to be leaking from anywhere.
For example, if infiltration or phlebitis occurs, you must discontinue the infusion. If IV therapy is still required, you will need to insert a new catheter or needle into another extremity. To reduce discomfort, elevate the affected extremity to promote venous drainage. Also, it may help decrease edema and discomfort to wrap the affected extremity in a warm towel for 20 minutes while keeping it elevated on a pillow.
Mr. Schwartz, I don't see anything impeding the flow of your fluids right now. They seem all right. One thing I want you to be careful of, though, when we do get you back in bed, is to be careful not to lie in any of the tubing so that it doesn't become kinked and slow down the rate of your fluids. All right? Good.
Document your assessment findings in the patient's record and report any problems you have identified, as well as any corrective actions you have taken. Use measurable terms for problems such as infiltration or phlebitis to ensure accurate documentation and monitoring. An infiltration scale developed by the Infusion Nurses Society can help you quantify signs associated with infiltration. 0 represents no problems. A score of 4 is given when there are signs such as blanched or translucent skin, edema greater than 6 inches in any direction, deep pitting edema, moderate to severe pain, or infiltration of any amount of blood product, irritant, or vesicant. A phlebitis scale is also available from the Infusion Nurses Society. In this scale, 0 represents no clinical symptoms with the site free of tenderness and inflammation. The highest score, 4, is given when a patient exhibits each of the following 4 criteria: pain at the site with erythema and/or edema, streak formation, a palpable venous cord greater than 1 inch in length, and purulent drainage. Mr. Schwartz's score is 0.